Hi, this is Dr. Desmond White from Desmond White Clinic. So the patient always asks, okay, in fact, hepatitis B patient always have this question. Every doctor that I see asks me to come back to see them every 6 months. And every time we do the same test, same ultrasound scan, they are not expensive, but neither are they that cheap. So they ask, why do they keep asking me to come back? Every time tell me the same thing. Can I stop coming to see my doctor? Can I stop all this stuff? Why bother? You want to hear the answer? Let me explain. So first, most of the hepatitis B patients, we take them very seriously. From studies, especially one big study from Taiwan called the REVEAL study, REVEAL study, they performed about 20 years ago. We learned that among hepatitis B patients, they are at risk of getting liver cancer and liver cirrhosis. The risk of liver cancer and cirrhosis is not very high. I would say combined, maybe 1% a year. 1% is a small number, but it is more than zero. So we know that liver cancer double the size every 4 to 5 months. So if somebody have a nodule of liver cancer 2 centimeters today, if we don't treat it, in 6 months time, it'll probably maybe 5, maybe 4 centimeters. So liver cancer double the size every 4 to 5 months. So experts postulate that if we see hepatitis B patient on a regular basis, if we see them every 6 months, even if I miss a cancer today, in 6 months' time, it is likely that we can see a bigger tumor. So there are actually studies that do on that, and we show that if we do a scan and do a blood test on the patient called alpha-fetoprotein every 6 months, we can actually pick up many more early cancers than if we just wait till they have a symptom. So that's why we check our patient's alpha-fetoprotein AFP, and we do an ultrasound scan of the liver every 6 months. Now, so when the patient come in and they say, doctor, you tell me the same thing. It was normal 6 months ago, today you tell me normal again. You're wasting my time. And I have to explain. It's not that we are wasting your time, okay? But it is good that you don't have any problem as of now. But based on statistics, we know that 1% will develop cirrhosis and cancer every year, roughly 0.5% a year to get cancer, and another 0.5 to 1% getting liver cirrhosis. So if we see you often enough, we can catch the cirrhosis and catch the cancer early, and we can treat them early. And many studies also show that liver cancer, if diagnosed before they have symptoms, they have much better survival rate, much better rate of cure compared to those that have symptoms. Okay, sidetrack a little bit, and that's mainly because our liver is a very accommodative organ. It has a lot of reserve. It takes a long time. It takes a lot of effort. It takes a lot of damaged liver to affect the liver function. In fact, many studies show that if I have an accident, I need to chop out 75% of my liver, 3/4 of my liver, my remaining 25% of liver can survive. So I use it analogy to explain to the patient. In your liver, if you have a liver cancer that's growing, you will not feel any pain, you will not feel any symptom, your liver function normally. But by the time the liver function got problem, by the time your eye become yellow, your leg becomes swollen, there's water in the abdomen, the liver reserve is probably less than 25%. That'll be too late for a lot of curative treatment like surgery, transplant, or ablation. So to sum up, we see patients with liver hepatitis B every 6 months with a blood test and a scan, mainly to hope to pick up any early cancer, any liver cirrhosis, any other thing that we can catch and we can treat to prevent complications. But what did other experts say? Well, the AASLD, the American Association of Study of Liver Disease, and most other professional bodies actually also recommend every 6 months, see a doctor, do an alpha-fetoprotein, do an ultrasound scan of the liver to pick up any early cancer and any liver cirrhosis. But you don't really have to see a specialist. Our family doctor, our family physician, GPs, they are qualified, they are trained, they know what to do. You can see the doctor in the polyclinic also, they're cheaper, or you can see your family doctor, they give you more comfort, a better relationship. You can get the scan done there under charge for some, or maybe under subsidy for others. Do a scan and the blood test. You don't really have to see a specialist. If the scan or the blood test is abnormal, then you come and see one of us, okay? So to sum up, we see hepatitis B carrier every 6 months because we want to pick up early complications. You don't have complication up to now does not necessarily mean that you will not have complication in the future. So I told my patient, if you don't like to come here, it's okay. but you have to see a doctor, see a family doctor to do a 6 monthly happy checkup. I hope you get the point. Thank you.